Hello, this is Michelle Walker. I'm first going to be scanning the room before we get started with our skills. So here we go. Okay, so this is Michelle Walker. I'm doing my skills. Today we're going to be doing the dressing a wound using sterile technique. And first I'm going to start off with doing the 12 safety practices. First, you want to verify the care and order of the client. You want to perform good hand hygiene before and after client care or handling any supplies. You want to verify the facility policy on any equipment that is used and supplies, gather your appropriate supplies that are necessary for your procedure you're doing. You want to consult with the manufacturer recommendations on any equipment that you may also be using. And then you want to knock on the client door, identify the client with 2 identifiers. You want to do an overall assessment of your client, and you want to explain the procedure to your client and then provide for privacy. You want to raise the bed up for good body mechanics. So raise the bed up to promote good body mechanics. You want to don any PPE necessary for the procedure. Upon completion of the procedure, you want to lower the bed to the lowest position. And then according to care plan, raise the handrails. And then always make sure the call light and personal belongings of the client are within reach. And then if there was any abnormal findings, you want to report that to the charge nurse immediately. All right, so I'm gonna go ahead and set up as I'm recording myself. Okay, so we have Mr. Bear here that has a wound, and it's a pretty significant wound on the upper thoracic. And before we get started, I'm going to assess Mr. Bear. I'm going to take his vitals, specifically his temperature, screening for any infection, and then I'm going to do a pain assessment. If the client is within significant pain, you want to medicate 30 minutes prior to doing this procedure. So he's not in much pain, so we're going to go ahead and proceed. The first part of this is non-sterile. So I've just got a drape here with some tools that I'm needing. I'm going to go ahead and take the dressing off and assess the dressing, and then we're going to assess the wound, and then we're going to dress the wound after cleaning it. All right, so I've got gloves on here, and you always want to make sure that you're considering the patient, making sure that they're not going to get woozy, so you're going to remove the dressing toward them so that they're not going to be seeing if they get queasy. All right, so we're going to go ahead and make sure you're always staying cognitive of the patient. If there's any tenderness with your touching, you want to make note of that, how they're tolerating this procedure. So we're just going to peel away from the skin gently. It's a bit hairy. Okay, and just kind of put the tape onto the wound there. Okay, all right, so we've got the dressing here, you want to, as you're taking off the dressing, you want to make sure you're making note of any discharge that's present. You want to look at the color, consistency, the amount, any odor that's present. That's all going to be part of documentation. So go ahead and take out the packing there. Okay, so once you've done your assessment of the drainage, the packing, you've made note of all the characteristics of it, you want to go ahead and dispose of that and the gloves that you're currently using, and make sure you follow your facility policy on disposing, whether it be biohazard or the trash. So I'm just going to go ahead and put it, this is my trash over here, and we're going to put on another pair of gloves, still non-sterile, and we're going to assess the wound. You want to note any drains that are present. You want to note the type of wound that it is, the skin integrity. This is a surgical wound, so I'm going to note that. You're going to look at the tissue integrity. Is there any necrotic tissue? The color of it. You want to notice the peri wound, which is on the outside, the skin on the outside, any redness. And then we're going to want to measure the wound. So we're going to go ahead, and you want to stay consistent with the documentation method of whether it be inches or centimeters of the prior nursing documentation. So we are going to go ahead and use our measuring tool here. I'm going to do length, width, and then use the cotton applicator to measure the depth. All right, so we're doing centimeters here, and we're going to go from one end all the way to the other. We've got 14 centimeters in length. We've got 3 centimeters in width. Now I'm going to take the cotton applicator here for the depth. You want to find the deepest part of the wound. That is right here, and you want to go ahead and just stick your applicator right in there, and then move your fingers down to the top of the skin there, the surface, and then that is going to be the depth. You're going to take that over to your measuring tool and measure that, and that's going to be 4 centimeters. Okay, that's done with. Then I want to go ahead and prepare my tape for my dressing. And since there's not a whole lot of drainage, I'm going to go ahead and just do a couple pieces of tape. Take a little bit off for the tag. So when you do a dressing, you want to make sure that I'm going to take this off here. Throw that in the trash. Well, make sure you take your pen, do your name, date, and time. Okay. And we're going to stick that over here. All right, so now that we have assessed the wound, we're going to go ahead and set up for our sterile field. And we're going to clean the wound and dress it. This will be my trash area. So we're just going to move that to the side. Take out my sterile dressing here. And you can always use this. It's a good trash bag. So I'll set that right here on that non-sterile field. All right, so setting up the sterile field here. Make sure you see me here. Okay, so we've got, you want to make sure that you also have just in case the first sterile gloving doesn't go too well or you puncture a hole, you've got an extra set. So I've got one off to the side that in case it doesn't go on appropriately, I have another one within sight. So pull away from you, making sure that you pay attention to the sterile margins around the border. And going forward. All right, so making sure that you don't reach over your field here. I'm gonna go ahead and just pull out my sterile gloves. We also wanna make note that, I'm gonna go ahead and pull that out, making sure you don't touch any. And I'm gonna set this off to the side where I can put my sterile gloving on. If you need any extra gauze or any other supplies, pads or anything, that before you put on your sterile gloves that you go ahead and drop that on. And so for instance, if I needed extra gauze, you would pull away, or you pull towards you and then dump away from you onto your sterile field. Okay. All right, so now I'm gonna go ahead, I have everything that I need. So I'm gonna go ahead and put on my sterile gloves. I did wanna note that if you are using wet gauze or need to do the wet and dry, the sterile saline is over here. I'm gonna pretend this is sterile saline. You wanna put the label in your hand and you wanna make sure that the bottle's not expired. So look at the integrity of the solution. You wanna uncap it with it up so that you don't contaminate the cap. And then making sure that you don't reach around or over your sterile field. You want to go ahead and pour onto the specific gauze that you want to be wet. And then cap it back on, set it off to the side. All right, so now we're gonna do the sterile gloves. So I'm going to make sure that you can see me. And making sure that I don't touch my sterile field. Make sure. All right. So pulling it open. All right, and you've got your borders here that you want to make sure that you're not touching the inside. Pull that open. All right. So I'm right-handed, so I'm gonna put my right one on first. So I'm just gonna grab, make sure that doesn't contaminate, touch your hand. It's gonna flap over anyway. All right, so got my fingers on the outside and make sure I'm pulling away from the field here and slipping that on. Fingers in the right spot. Okay. All right, so I've got that one on. Then you're going to take this one and grab the inside. And making sure you don't touch. So you've got it inside here. Pull it down. Okay, so now that I have my sterile gloves on, not going to touch that field anymore. We're going to keep our hands between our shoulders and our hips, making sure that we never turn our back on the patient or the sterile field. And then making sure that we always reach around, don't cross your hands over, making sure that you really make sure that you use the sterile technique and not cross-contaminate. So I'm going to go ahead and clean the wound here. We've got our gauze and we can reach over our field now since we're all sterile. And I'm going to take 3 pieces of gauze here. And get our pad off to the side there. Okay. So we're gonna take one, starting with the least contaminate part. We're gonna swipe down the middle of the wound. So going down, making sure you don't contaminate yourself, and reach around your field, throw it in the trash bag. Gonna take my other one here and swipe the outer side. trash. And wipe the outer edge. 1 stroke each gauze. Now we're going to go ahead and pack the wound. So I've got a forcep and an applicator here that I'm going to use. This one, since it's pretty deep, I'm going to use quite a bit of gauze here. And you want to make sure that when you do pack, that you're not tightly packing it, but making sure that it doesn't overflow the wound. So I'm going to go ahead and use your sterile cotton applicator here. And just kind of pack that in there. Okay. All right. That looks pretty good. Okay. So we are going to put that here. Okay. And then we're going to go ahead and put 2 pieces of gauze right over. I did want to note, when you do assess the wound, that you wanted to, and I'm pretty sure I said this, but you wanted to make sure that you check for any tunneling around the ridges with your cotton applicator, just running that along the sides, the edges of the wound. If there's any hole tunnel, you're going to measure that with your applicator as if you were measuring the depth, moving your finger to the edge of the wound and then measuring that on your measuring tool. And for documentation, you would put that as, say there was a tunnel at 3 o'clock, you go 3 o'clock, a tunnel 3 o'clock, and then 2 centimeters. All right, so we're gonna put 2 dry gauze on there. And then you're gonna take your ABD pad and with the little flaps on the top, putting that right over. And then this procedure is no longer sterile as it's covered, so you just want to grab your tape here. So I'm going to grab 3 pieces of tape. And last one here. And then also make sure that you grab your label with your name, date, and time. Put that on there, okay? And then again, assess how your patient tolerated the procedure. You want to make sure that you take off your gloves and dispose of that per your facility policy. And put that in my trash bag here, as well as all your other supplies. And that is it. Thank you so much.